Literally 1/3 of American adults have prediabetes. And what's very interesting about it, that according to the CDC, only a small percentage, as low as 20 to 30%, know that they have it, meaning that a lot of people have prediabetes and don't know it. And what prediabetes is it's a state or a condition where your blood glucose level or your sugar is too elevated, but it's not high enough to be diabetes, but it's so high that you have a diagnosis of prediabetes with a high probability of developing diabetes if you don't make a change to your lifestyle, meaning you don't need medication at this point, but you have to start eating healthier, exercising, and you can actually reverse it where you no longer have that elevated blood glucose and you can avoid getting diabetes.
Of course, we want to avoid getting prediabetes. What can an individual do specifically to avoid it? And if they happen to have it, how long does it take for prediabetes to go away?
That's a good question. Well, basically, if you are somebody that goes to see your medical doctor, and interestingly, the state of Mississippi employees, people that work for the schools, like my teachers, my bus drivers, if you work at UMC or any state of Mississippi facility, you have what's called State Blue Cross Blue Shield. Part of their annual wellness exam includes a screening for prediabetes. And if your hemoglobin A1C, which is the test we look at, if it's between 5.7 and 6.4, you have prediabetes. Now, what we as medical doctors do is we advise healthier lifestyle changes. Exercise more, eat a healthier diet. And if you can stick to that regimen, that can help you avoid getting diabetes or even reverse it where your A1C is lower. But the take home is you want to know your status. And if you do have it, it's not a death sentence. You can actually beat it, but you got to put in those lifestyle changes.
Absolutely. How often, Dr. Quinn, do you encounter patients with this diagnosis?
Well, like I said, it's very common. According to the CDC, 1 in 3 adults in America has prediabetes. And as far as converting to diabetes, it normally takes a very long period of time. It could take years, anywhere from 3 to 10 years. But like I said, if you implement those positive lifestyle changes, you can not only reverse it, you can avoid diabetes, and you can live the healthy life that you deserve.
All right, so there is some time to avoid that, but you want to start now. Thank you so much for your time, Dr. Quinn.